My name's Lucy Perrow. I'm a clinical lead dietitian for a specialist weight management service. Although I'm a prescribing dietitian at the moment, the main drugs that I did my prescribing to do is the GLP-1s, the Wegovy and tirzepatide or Manjaro. I'm really excited because there's so much out there now about the benefit of these drugs in cardiovascular disease, obesity, diabetes. Very excited to get the funding to start prescribing these drugs.
These drugs are in the media every day. There is over 1 million people already buying them privately online. Once I think they're in the NHS and available and the funding is there, there's something like nearly 6 million people will qualify. If the GPs are prescribing them or waiting for consultants, it's a very expensive part of the healthcare system. If we can take that burden off consultants and GPs and get the dietitians independently prescribing them as part of an MDT with our physio colleagues or nursing colleagues, psychology colleagues, as part of an MDT to help treat obesity and manage obesity and prescribe the drugs appropriately and most cost effectively, and give that alongside the dietetic advice that needs to be provided, I think we will save the healthcare system and the NHS so much money and free up that GP and consultant time and get these drugs prescribed out of hospital care. They don't need to be prescribed by consultants within a hospital to manage obesity. That can be managed within a community setting and free up costs and time for those other healthcare professionals. I've been working in this field for over 20 years. I know a lot more than a GP would know about prescribing these drugs. The dietitians know the dietetic advice, and we've been working with these drugs for years and years and years alongside doing the dietitian advice, that if we can marry up the two, I think we are best placed in, not in every field, but a lot of fields where we are confident and experienced, we can be best placed to prescribe these drugs. Being able to independently prescribe means that I think we will free up GP and consultant time in the treatment and management of obesity when GLP-1s are available on the NHS.